We begin this morning with heartbreak here in New York City. A fire killed more than a dozen people, including children, in a Bronx apartment building and left more than 60 others hurt. It's one of the deadliest fires the city's seen in decades. New York's fire commissioner says a malfunctioning electric space heater sparked the flames in the 19-story building Sunday morning. Nearly 200 firefighters responded to the scene. In the aftermath, the city's new mayor, Eric Adams, and New York State Governor Kathy Hochul said they would rally behind the victims.
This is going to be one of the worst fires that we have witnessed during modern times here in the city of New York.
It is such a tragedy, thinking of children, thinking of families, thinking of so many people in this building, immigrants striving to climb that ladder up and their lives snuffed out. It's awful. I want to thank our firefighters. Unbelievable. They always rush to danger.
NBC News correspondent Isa Gutierrez joins us now from on the ground in the Bronx. Isa, good morning. So we know officials say this fire started because of a space heater, but we're also hearing about what went wrong that allowed the fire and smoke to spread so quickly, whip throughout this whole building, doing so much damage, causing so many fatalities. Tell us about those details. What have we learned?
That's right, Savannah. Good morning. So what the fire commissioner said is that investigators were able to determine that this fire caused by a malfunctioning space heater, like you said, actually started in a two-story unit that was on the second and third floor of this 19-story building. Now, the issue they said that they found based on physical evidence as well as accounts from residents is that that apartment door was open. And what that allowed to happen with the fire is that it was able to spread into the hallway. After that fire spread into the hallway, the smoke then engulfed the entire building. And as we know, it was that smoke that really did the damage here. Like you said, nearly 200 firefighters responded to the scene yesterday. They actually ran out of oxygen in trying to rescue all of the residents who were stuck in this building trying to get out. Those images, just tragic. Those firefighters trying to hoist out the victims through the windows, down ladders to get to safety. Many of them were not able to get to safety yesterday. Savannah.
And Issa, this is the deadliest fire in New York since 1990. There are 19 fatalities here with this fire. Tell us what we know about the victims.
Well, Savannah, we're expecting to hear an update from officials in just the next few hours. But what we know is that right now, 19 people died in this fire here yesterday, 9 of them children, dozens still at various hospitals in the city, many of them fighting for their lives, primarily from smoke inhalation. We also heard from the Red Cross. They said that they're working with over 20 families who've been displaced from their apartments. We also heard from officials that many families were staying in the area overnight, hoping to get back into their apartments, but it's unclear right now whether it'll be safe for them to do so. Savannah.
All right, Isa Gutierrez, thank you so much for the latest from the ground there. And joining us now is NIKEYA Gonzalez. She was a resident at that building. NIKEYA is with us this morning to walk us through exactly what her experience was. NIKEYA, good morning. First of all, just tell us, how are you doing this morning? We're so sorry for what you've been through. Tell us how you are.
Me and my family are staying with our aunt right now, and we're doing okay for right at this moment.
All right. Well,
we have people checking on us, you know, a lot.
Oh, that's great to hear. It's good that you have that community around you. So take us back to Sunday. First, just tell us, where were you when the fire started? Where is your apartment in relation to where this began? And what did you see?
2 stories up on the 6th floor. The alarms went off in the building, and normally, you know, sometimes they do, but you can get them, the security can get them to turn off. And when it came right back on, you know, and they turn it off, you start to wonder, is something wrong? And then by the 3rd time, they couldn't get them to stay off. You know, my husband's friend called and said, you know, there's people in the window screaming help. So by the time we got the citizens alert to say it was a fire 50 feet from us, my husband got up and opened the door, and the hallway was getting smoky. And he said, throw on something. And by the time I went to wake up my 2 nieces and we put on just a coat and shoes, it was so black and smoky, we couldn't even get out the house. We had to go right back in. and also help neighbors that were trying to leave their houses from higher floors that were trying to come down because it was so dark that you couldn't see your hand in front of your face. So we just let some people in and we closed the door and we tried to put wet towels and rags around the door on our face, but it just got so black and smoky. You know, we was coughing and choking. I was trying to move people around, put them in, you know, rooms where, you know, the bathroom where there was no windows or, you know, a side closet. And it was just so scary and, you know, just trying to make sure that we got out all right.
Absolutely. And so, NIKEYA, am I understanding right that the way that you understood that there was this fire happening in your very own building was from that app, Citizen, that notifies people of some type of activity around them?
It started with the alarm for the building, the fire alarm for the building, and then the Citizens app, and then every fire alarm in my apartment. We have one in each room and one in the hallway and the kitchen and the living room, and everything just started going off so crazy and just it wouldn't stop. But the fire department couldn't take us out because they were trying to put out the fire. So once they were able to get us safely through, they knocked on the doors and we was able to open. They said, you know, just they showed us the light to the stairs, just follow it till you get downstairs and you see light. It's just like hold on to the walls and walk in the dark until you can get out.
Wow. And NIKEYA, one of the things that we've heard from residents, we actually played some sound at the top of our show with a resident saying this, is that there were not fire escapes on this building. So what was that process of evacuation like? Were those halls crowded on your way out as you're going through this smoke? Were a lot of other residents on their way down?
It was, you really can't tell how crowded anything was because it was just black. It was black. It was just really black. I have two little dogs. I had one in my right hand and one on a leash in my left hand. And she got stuck on the stairs, tangled up. And I had to move out of the way so that a firefighter could bring a little child by that had on no clothes, no shoes. And I had to try to untangle her and get her picked up because I couldn't see her. I couldn't hear her. You couldn't see anything. It was just total pitch black. And as we were trying to go down, fire department was trying to come back up to save more people. It was just really, really help your neighbor, do what you can to help the community. They did a great job and they saved us.
And NIKEYA, did you know anyone who was killed or injured in this tragedy?
My sons and them showed me that they at least know two of the children who died.
I'm so sorry to hear that. NIKEYA Gonzalez, we're so happy that you, your nieces, your dogs are out safe. We are thinking about you, and we hope that you're able to get home soon. Thank you so much for joining us.
Thank you very much.
Now, this morning, U.S. and Russian officials are meeting in Geneva for high-stakes talks aimed at de-escalating tensions over Russia's buildup of troops on its border with Ukraine. Last night, a working dinner was held in preparation for today's talks. But speaking on ABC yesterday, Secretary of State Antony Blinken downplayed expectations for any major developments.
I don't think we're going to see any breakthroughs next week. We're going to listen to their concerns. They'll listen to our concerns, and we'll see if there are grounds for progress. But to make actual progress, it's very hard to see that happening when there's an ongoing escalation, when Russia has a gun to the head of Ukraine with 100,000 troops near its borders, the possibility of doubling that on very short order. So if we're seeing de-escalation, if we're seeing a reduction in tensions, that is the kind of environment in which we could make real progress and, again, address concerns, reasonable concerns on both sides.
We have a team with us to cover this story. NBC News reporter Matt Bodner is in Moscow, and NBC News White House correspondent Carol Lee is in Washington. Thank you both for joining us. So, Carol, I'll begin with you and tell us, as we just heard there, Secretary Blinken say, it doesn't seem like there's hope for much to happen here, but what can we expect from today? And are there any signs we could get some positive progress?
Yeah, Savannah, this is really the summit of low expectations. Both sides are saying that they don't expect much to come out of this. And look, the White House went into these talks with really no idea whether or not Russia is serious about reaching some sort of diplomatic resolution to this crisis. Now, the State Department issued a statement after this initial round of discussions with Deputy Secretary of State Wendy Sherman saying the U.S. said she stressed the U.S. commitment to international principles of sovereignty, territorial integrity, and the freedom of sovereign nations to choose their own alliances. They also added that the Deputy Secretary affirmed that the United States would welcome genuine progress through diplomacy. Now, to that end, U.S. officials went into these meetings with a set of various options, both for what the U.S. would do if Russia does further invade in Ukraine, how they would respond, and also what they're calling some confidence-building measures, and meaning what the U.S. is willing to discuss as part of a diplomatic resolution to this. Now, in terms of how the U.S. would respond, they're saying they would do things like very punishing economic sanctions, block Russia from receiving certain technologies, and also increase NATO's presence, troop presence, and military assets in the region if Russia were to invade. In terms of what they're willing to discuss as part of a diplomatic resolution, they're saying they would discuss things like military deployments, missile deployments, and military exercises, the scope and scale of those. Now, the White House says that cuts to U.S. troops in the region that's not on the table, but our own reporting shows that there are ways in which certain options that they are willing to discuss would decrease the U.S. troop presence in the region. But all of that, Savannah, is really for next steps, because first the U.S. has to determine whether or not Russia is serious about this, particularly when the U.S. is saying they're not going to meet some of Russia's key demands.
Absolutely. Let's actually talk exactly about those demands. Matt, I'll bring you in here. So Russia's deputy foreign minister said last night, first, that talks aren't going to be easy, but we also do know this list of demands that Russia's hoping to get out of these talks. Let's talk about those.
Sure, Savannah. Well, Russia's demands are extensive, and just based on the way the United States and NATO have reacted to them, they're obviously unpalatable to Washington, to the Western alliance. They essentially amount to the restoration of the 1997 status quo between NATO and Russia. So that would be reduced presence, reduced borders. They want to see limits on things such as missile deployments and exercises, and really any kind of Western presence in Eastern Europe. Now, the big question, of course, as you mentioned, is Russia serious about these demands? They are, as I mentioned, obviously unpalatable. Actually, the only thing that I can think of that would make them more of a non-starter, again, based on what NATO and the U.S. have said so far, would be including a demand that the eastern members of the bloc are essentially kicked out of NATO. Russia, at least based on the demands, doesn't want to see NATO anywhere close. Now, this is, of course, a very hard bargaining position, and one of the possibilities is that Russia is just staking a really hard line here, hoping for something less, perhaps an agreement on medium-range missiles in Eastern Europe, for example, the kinds of weapons that used to be covered by the INF Treaty. But these are very serious demands from Russia, and we're now just waiting to see, is that serious or is this a negotiating tactic?
Absolutely. So, Carol, we already heard sort of what the White House is willing to do in terms of those demands. But quickly, just tell us, what kind of leverage does the U.S. have in these talks? I mean, how far is Washington willing to go in the event that negotiations break down? And worse, if Russia did invade Ukraine?
Well, that's one of the big questions, is what the leverage is. And from the U.S.'s perspective, their argument is their leverage is that they are very closely aligned with their European partners on how they would respond if Russia were to further invade Ukraine. And so they're saying that they would have punishing economic sanctions, and those would not necessarily have the kind of teeth that they would want if Europe wasn't on board with taking those steps. The administration says that Europe is on board with taking some serious steps that would hurt the Russian economy, and at the same time that they're also willing to, the U.S. is also willing to put a little more skin in the game in terms of military assets in the region. They also say that they would send military aid, more military aid to Ukraine if this were the case. So they feel like they have a number of options. At the same time, it's not clear at all whether it's enough.
Lots to keep our eyes on there. We'll be checking back in. Carol and Matt, thank you both so much for joining us.
Now to the pandemic. The Omicron surge is putting a strain on the nation's healthcare system as more Americans are infected. That includes an increasing number of children. Overnight, the U.S. surpassed 60 million COVID cases since the pandemic began. More than 1 million new cases were reported just over the weekend. Hospitals are now seeing a growing trend. Patients admitted for other ailments are also testing positive for COVID. Doctors say that might mean the COVID case numbers are actually higher than what's currently being reported, that many people out there may have an asymptomatic or undiagnosed case. Doctors are also noting the concerning rise among children in the hospital with COVID. Average daily hospitalizations among kids have increased by 134% over the past 2 weeks. It's especially concerning for kids under 5 who are still not eligible for any of the coronavirus vaccines. NBC News medical reporter Erica Edwards joins me now. So, Erica, doctors say the Omicron variant appears to be affecting kids younger than 5 in a new way. What is it doctors are seeing as more young kids get infected?
Hi, Joe. Good morning. So because the Omicron variant tends to settle a little higher up in the respiratory tract, that's causing a lot of inflammation and swelling in those kids' tiny airways. And as a result, doctors are seeing a big increase in COVID-related CROUP. That's that barking, sort of seal-like cough that young kids, typically occurring in young children. Again, once you've heard that cough, you know it. It's a loud barking cough. Sometimes they can develop fever, a hoarse voice, and you can also hear it when they are breathing. Now, it's not fun. It's not fun to listen to, but of course, the silver lining here is that CROUP is generally not harmful. And in fact, doctors have decades and decades of experience treating it. Other viruses also can cause CROUP. Of course, doctors don't want kids to be infected in the first place. CDC Director Dr. Rochelle Walensky spoke on Fox News yesterday, talking about the best ways to protect children.
The vast majority of children who are in the hospital are unvaccinated. And for those children who are not eligible for vaccination, we do know that they are most likely to get sick with COVID if their family members aren't vaccinated. So the most important thing we can do for those children to keep them out of the hospital is to vaccinate them and to vaccinate their family members around them.
Now, vaccines are not expected for kids under age 5 until later this year. Joe?
Erica, it is not just kids. We're seeing a rise in COVID hospitalizations among all age groups right now, but doctors are now saying a lot of them were not initially admitted for COVID. So what is it that's happening at hospitals around the country?
Yeah, this is a nationwide trend we're hearing that's emerging, where people are coming into the hospital for reasons other than COVID-19, but because of testing policies for any patient who is admitted, they are then finding out that they are COVID-19 positive. Here's what 2 doctors, one in New York, the other in San Francisco, had to say.
They might be having a stroke, they might be having a heart attack, and they just end up being positive just because of the community spread right now.
As of Tuesday, we had 40 adults hospitalized under the designation of COVID positive. But of those 40, only 12 were hospitalized for COVID illness.
Now, while that might be a good sign that Omicron indeed is a little less severe, it could also mean that people are coming in testing positive for COVID-19 before they start feeling sick. And Joe, we know that in general, people are most contagious right before those symptoms begin.
All right. Very interesting. Erica, thank you so much.
Let's now bring in NBC News medical contributor Dr. Kavita Patel. Dr. Patel, good morning. Always great to have you. So let's talk about Omicron and when we could potentially see the end of this. I mean, are we anywhere near the peak of this surge? What could the next few weeks be like?
Yeah, Savannah, good morning. So the next few weeks are going to change depending on where you are. We're already seeing some cases declining in the northeast parts of the country, which is an indication of a peak, but that is still yet to be seen in Midwest and the western parts of the country, where we do think in the next several weeks we'll see a peak. Here's the good news: that there can be. Cases should decline rapidly. It's what we've seen in other countries and what we're seeing in parts of the United States.
And Doctor, we just heard from Erica on how Omicron is impacting kids, especially kids younger than 5. So 2 questions for you here. The first one, when do you think that age group will be eligible for the vaccine? But also, we just heard from CDC Director Dr. Walensky on Friday saying that only 16% of kids 5 to 11, those who are already approved for the vaccine, are vaccinated. So really, are the concerns broader than just waiting for the shot for our youngest kids, if that's the stat right now?
Yeah, I do think there were concerns for the 5 to 11 age group about any of these kind of adverse or side effects or events. The CDC just released a report that was very helpful that showed essentially no serious adverse effects. I hope that increases vaccination rates, especially as kids return to school. In terms of the under 5 age group, unfortunately, we are not going to see a vaccine in time for this particular surge. We estimate the second quarter of this year will be when Pfizer has the sufficient data. They had to add a 3rd dose for the under 5 age set because of the initial data not being effective or efficacious enough. So hopefully around the April-May timeframe.
All right, great info there for parents. Dr. Kavita Patel, as always, thank you.
Thank you.
2022 is off to a busy start. This week on Meet the Press, the focus is on schools, once again faced with difficult choices about remote learning as Omicron cases surge.
Yeah, plus after the anniversary of the January 6th riots on Capitol Hill, where does the House committee stand on its investigation? Moderator Chuck Todd covers this and more in this week's Meet the Press Compressed.
Good morning, Savannah and Joe. On this week's Meet the Press, positive COVID test results, hospitalizations, and deaths are all heading in the wrong direction. They're heading up. Meanwhile, the CDC's muddled messaging continues to erode confidence, and schools are struggling with closures. I spoke with the mayor of Chicago, Lori Lightfoot, and a pair of infectious disease experts, Drs. Emanuel and Gounder. Plus, my interview with Republican Congressman Adam Kinzinger on January 6th and the future of the GOP. Here are some of the most important answers from Meet the Press Compressed. Are kids going to be in school this week in Chicago?
Well, I'm doing everything I can to make sure that that happens. And to be clear, what the Chicago Teachers Union did was an illegal walkout. They abandoned their posts and they abandoned kids and their families. We are working diligently every single day at the bargaining table to narrow the differences and to get a deal done. My team has been working every single day. They're back at it again here Sunday. They were at it yesterday. And we can get a deal done if there's goodwill on both sides. But fundamentally, what we cannot do is abandon the science. We know that the safest place for kids to be is in-person learning in schools. And we've spent hundreds of millions of dollars to make our schools safe. They are safe. We've got the data to demonstrate that. We've got to get the teachers union to get real and get serious about getting back into in-person learning.
You guys are saying what others have been saying. This is not a pandemic anymore. It's an endemic. So what changes have to happen now?
The proposal is we need a strategic plan for that covers vaccines, getting more people vaccinated. And the only way to do that, as we've been very clear over time, is mandates. We got voluntarily to about 60%, but to get beyond that, we are going to need the employer mandate that OSHA's put out, the healthcare mandate that CMS has put out. We need to improve our ventilation system. We need to get more therapies and get the link between a positive test and getting a therapy much closer so you can actually start in 3 days and not only the rich and well-off get it. Those are the kinds of things we need to put in place over the next 3 months to be prepared when COVID is really just in the air. It's going to be here. We're going to learn to live with it.
What we're really proposing is let's focus on what matters the most, hospitalizations and deaths. That's what we focus on for other respiratory illnesses like the flu, like RSV. How do we do a better job of preventing those hospitalizations, those deaths, particularly among the most vulnerable, so the elderly, people who are highly immunocompromised, people who are living in long-term care facilities, and of course, communities of color and others that have been highly vulnerable during this pandemic.
If you got no more information submitted to this committee right now, how much of the story do you think you have?
I think a significant part. I think where we're at right now, we know a lot of the narrative. And as I've said, I think the most important thing is not even the day of January 6th, it's what led to it. We have a lot of what's out there in the public venue, what the president himself said. The fact that he was watching for 3 hours on TV, probably gleefully while this happened. So I think if everything shut down today, we'd be able to put out a powerful and substantive narrative. We still have more information, obviously, we want to get.
All right, our thanks to Chuck Todd for that recap.
This morning, tributes are pouring in for actor and comedian Bob Saget, who died suddenly yesterday at the age of 65. He was best known for playing Danny Tanner, a single father on Full House, and for hosting America's Funniest Home Videos. Saget was on a stand-up comedy tour. He was found dead Sunday in a hotel room in Orlando. Authorities say they saw no signs of drug use or foul play. The medical examiner will ultimately determine the cause of death. Entertainment journalist and pop culture expert Brian Balthazar joins us now with more on this. Brian, good morning to you. So, Saget starred in some massive TV hits over the years, especially in the 80s and 90s, usually playing a family-friendly character, but he had an even longer career on stage as a stand-up comic, sometimes doing some pretty edgy material. Talk a little about these different sides of his persona and really just the legacy he leaves behind.
Sure. So I'm actually in Abington, Pennsylvania, where he went to high school, and he was married just blocks from me. So he's close to New York City. You know, he grew up in Philadelphia, and he got his comedy chops in New York City, surrounded by some racy comedy. And though we came to know him as Dad, you know, as one of the characters on Full House, he, in fact, had quite a racy, raunchy side. And he really showed that in his stand-up comedy. And I think in his later years really kind of played to that, because he could be raunchy, he could be blue, but he also was an actor and he could play a character. So some people knew him from one thing. I guess that a whole generation of kids did. And then you could go out to a comedy show and be like, wow, this is a different Bob Saget. But what was universal about Bob was that the Hollywood community truly, truly found him to be one of the nicest, most kind and generous people in the business and that they knew in general. So I think that really speaks to the kind of person he was. He was more than just an actor. He was more than just a comic. He was a really wonderful, kind and generous human being.
The thread you see in almost all the comments about him over the last, 12 hours or so is just how nice and kind he was. By the way, there's a movie called The Aristocrats that I highly recommend folks check out. A little bit raunchy, but Bob Saget's a part of that one. Overnight, we did hear...
just a little bit raunchy. Yes, exactly.
It's a warning. Overnight, we did hear from some of the former cast members who knew Saget best. What are some of them saying?
Yeah, sure. So first of all, the whole cast is really gutted by this, starting with Candace Cameron Bure. She said, "I don't know what to say. I have no words. Bob was one of the best human beings I've ever known in my life. I loved him so much." Dave Coulier, an actor and comic who also shared the stage with him. "My heart is broken. I love you, Bob. Your forever brother, Dave." And John Stamos, "I am broken. I am gutted. I am in complete and utter shock. I will never, ever have another friend like him. I love you so much, Bobby." And then we have Ashley and Mary-Kate Olsen, who shared a role on Full House. And they said, "Bob was the most loving, compassionate, and generous man. We are deeply saddened that he is no longer with us, but know that he will continue to be by our side and guide us as gracefully as he always has." That, of course, the cast of Full House, but the whole Hollywood community, from Norman Lear to Gilbert Gottfried, Nikki Glaser. Pete Davidson even said that he helped him get through some mental health problems. So a lot of people are expressing their condolences today.
Quite a legacy. All right, Brian, thanks so much for helping us remember. We do appreciate it.
Time now to get a check on your morning news now weather.
Bill Cairns is with us. Bill, good morning.
Good morning, guys. I'm afraid I'm becoming very predictable with my complaints.
I think that might be true. But we'll hear them anyway.
See,
we're here for you.
Yes, you will. See, there's only 2 or 3 times every winter where I'm like, why don't I have a remote car starter? It's not that difficult. They're not all that expensive. All you do is you push a button, the car starts, it gets warm, and then you can go out when it's a freezing cold morning. I mean, in Minnesota, it's like a requirement, you know?
Yeah.
Oh, well. So, all right, let's get into this. The Arctic blast that's coming down is going to have a lot of people wondering why they don't have remote car starters in the next 2 or 3 days. In some cases, this will be the coldest air we've seen in 3 winters, going all the way back to 2019. And this morning, that Arctic blast is starting to come down out of Canada. It's already moved into International Falls, where the wind chill currently is -38. Not a fun morning in Minneapolis with a temperature of -7, wind chill at -24. And all of this cold air is heading for the northeast as we go throughout the day today and into tomorrow. So here's the forecast for this afternoon. This is not horrible. Yes, not fun in Minneapolis, up to International Falls, Green Bay included, Duluth. But the Great Lakes in the Northeast, this is just the cold air starting. You'll really feel it with the wind chills as we wake up Tuesday morning. New York City, -1. I'll look at northern New England. Saranac Lake, -38 towards Lake Placid. So very cold, easily the coldest this winter. And as I mentioned, the coldest in years. And then it just doesn't warm up Tuesday afternoon. We're going to stay below freezing, even with the sunshine in Caribou and northern portions of Maine. Boston only at 12. New York, a high of only 19 degrees. So you get the idea. But the good news with this one, it's in and it's out. So it's a quick blast of 2 days of very cold air, and then we warm it up and moderate it as we go towards the end of the week. So as far as the forecast goes for today, guys, there's also lake effect snow, but we don't have any big snowstorms this week or ice. It's just cold weather complaints from this house.
Ooh, yeah, cold, cold, cold. I heard it's pretty much just going to drop today from the time that we got out here, and it was already cold this morning.
Yeah. It's going to be a long one, I guess.
All right.
All right. Thank you, Bill.
Good to see you, Bill.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.